Welcome to From Challenge to Change, leading rural communities toward better health outcomes. My name is Merlene Tucker, and I'll be running today's web forum along with my colleague Leah Randazzo. This web forum is sponsored by the Leadership Academy for the Public's Health and produced by Dialogue for Health, both programs of PHI Center for Health, Leadership, and Impact. Now let's meet the moderator of today's event, Dr. Carmen Rita Nevarez. Carmen is a senior advisor at PHI Center for Health, Leadership, and Impact, founder of Dialogue for Health, and senior vice president emeritus of External Relations and Preventive Medicine at the Public Health Institute. Welcome, Carmen.
Thanks so much, Merlene, and welcome to all the participants and our great speakers today. This is really very exciting for me. Today's the second webinar in our 2025 Leadership Academy for the Public's Health Masterclass series, which features LAPH alumni team representatives Angie Tagtow from Going Bold, Iowa team, and Brandi Hamilton from the Madison County Environmental Roundtable team. We will be focusing on chronic disease prevention in rural communities, highlighting the unique role of collaboration and strategic partnerships in improving health outcomes, addressing barriers, enhancing resources, and creating lasting and positive change impacts on community health well-being. So just to give you a quick rundown, what we're going to do is a little bit of intro, and then we'll go into some discussion questions. During this discussion, I want to make sure that we're getting your questions and your ideas. So please, please, please feel free to use the chat, ask whatever questions you like. I'll do my best to incorporate them. And if there's some comment that you want to make about what we're talking about, please go ahead and enter your comments, and we will do our best to make sure that everybody can see them or that I reflect them in the conversation. Okay, let me go ahead and do introductions. We'll start with introducing Angela Tagtow. She's the founder and chief strategist of Tagtow Strategies, where she strengthens adaptive leadership skills of executives, organizations, practitioners using a systems-based methodology. She's a former executive director of the USDA's Center for Nutrition Policy and Promotion. Dr. Tagtow co-led the development and release of the 2015 to 2020 Dietary Guidelines for Americans and expanded evidence-based nutrition communications nationwide, representing the United States internationally, and provided congressional testimony on critical nutrition policies. We definitely need you now, Angie. Her groundbreaking work includes the development of the conceptual framework for action, which addresses complex challenges by assessing determinants of health and formulating multidimensional strategies. In addition to founding the Journal of Hunger and Environmental Nutrition, she has a publication records that includes peer-reviewed articles, book chapters, professional resources focused on nutrition policy, sustainable food systems, and public health leadership. Dr. Tagtow's academic credentials include a Doctor of Public Health from University of Illinois, Chicago, focusing on structural empowerment and systems thinking amongst healthcare dietitians. As a registered dietitian, she's completed multiple fellowships focused on food and nutrition policy, public health, and sustainable agriculture. Great, and welcome, Dr. Tagtow. Great to have you on this call. Brandi Hamilton is a geologist who's been engaged in the public health sector since 2020, when she began working for the Missouri Department of Health and Human Services, and currently serves as a member of the DHSS Environmental Health and Risk Assessment Program and as the manager for the Missouri Radon Program. She's been a licensed lead risk assessor for the state since 2022, with much of her work centering around providing technical assistance for environmental contaminants in Missouri. She's written documents on lead, radon, and other naturally occurring radionuclides, and responds to issues involving other chemicals and concerns associated with Superfund sites. She's been involved in several environmental epidemiology projects and has experience both leading environmental sampling operations and conducting public outreach at the state and local levels. She's drafted quality control measures for environmental sampling and data management plans and encourages the use of verified information to make data-driven decisions. Brandi is an alumna of the National Health Leadership Academy for the Public's Health. She completed the program in Cohort 11 with Madison County Environmental Roundtable, a team focused on providing health services to lead-impacted communities linked to historic mining sites. Brandi earned her BS in geology from Wittenberg University and her MS in geological sciences from Ohio University. Welcome, Brandi. So let's go ahead and get on into the discussion questions. This is very exciting. We have two great experts with us today, so I'm excited to start pitching some questions in your direction. And I think we'll be spotlighting. Okay, there we go. Excellent. Thank you so much. Okay, so Angie, why don't we start with you, and you could tell us about the work you've done in chronic disease prevention, and what kinds of specific challenges that you've been facing when doing this work specifically with rural communities.
Yeah. Thank you, Carmen, and thanks for the opportunity to join you today. I guess you could say my entire career, 30 plus years, really centers around chronic disease prevention. I've done state level work in cardiovascular disease prevention. I worked in WIC at the Iowa Department of Public Health at the state level. So nutrition security has been central to my work, and of course, food, ag, and agriculture policy as well. So a very unique combination of nutrition, dietetics, public health, and food systems work here in Iowa and of course nationally. Nationally, as you mentioned, Carmen, I did oversee the 2015-2020 dietary guidelines for Americans. That included, systematic reviews to support the dietary guidelines, consumer education around my plate, but a lot of that work was around nutrition policy and steering scientific and technical assistance across the federal family. And on a scholarly level, of course, looking at public health leadership and applying a lot of those principles, of course, today. How do we advance policy, system, and environmental change strategies in our work? And of course, elevating the concept of systems thinking and structural empowerment among practitioners. And so, this issue of specific challenges facing our work today, I think the timing of this question is quite fascinating because I think I would have answered it very differently 7 or 8 months ago. And I, of course, would have identified the geographic access issues that limit access care and create a fragmented network of services in rural areas. Of course, I would have addressed funding and resources and identified the fact that there has been a long history of disinvestment in not only public health, but chronic disease prevention, and especially in rural areas. We could talk about the workforce shortages and the capacity of public health and healthcare practitioners within rural areas. And then, of course, we could explore the demographics of rural communities and the tendency that rural communities have in having an older population, having a higher prevalence of chronic disease and mortality, and often lower median household incomes, and how all of those determinants of health are connected. However, I would like to perhaps reframe my response to the question, Carmen, about specific challenges facing our work today, and especially in rural areas. All of those challenges that I just highlighted, of course, still exist, but the list of challenges, I think, is even greater today than it was 7, 8, 9, 10 months ago. And I think it's safe to say that public health practitioners today work in what we call volatile, uncertain, complex, and ambiguous environments, and maybe even amplified today. When we look at the federal fiscal budget of 2026 that was signed on July 4th, it, to me, significantly multiplies the challenges of implementing chronic disease prevention initiatives in rural areas. It's estimated that the federal government will eliminate approximately $1.4 billion in chronic disease prevention funding. And there's a plan in place to eliminate the Centers for Disease Control, National Center for Chronic Disease Prevention and Health Promotion, as well as a whole host of other chronic disease related programs within the Department of Health and Human Services, and of course within USDA as well. And I think the challenges are further going to be compounded by shifting this financial and administrative responsibility and those associated costs to states. And it's going to put greater financial and workforce burden on those state governments. Here's an example that I want to put forth for folks that demonstrates this compounding challenge that states are going to have. The combination of having stricter work requirements for both Medicaid and SNAP will likely result in millions of individuals who, they simply will no longer be receiving these benefits. And so when you increase a population who doesn't have access to health care and perhaps has lower access to food, we know that the rates of nutrition insecurity and chronic disease are going to increase. And furthermore, the proposed changes that we are seeing in Medicaid, the Urban Institute estimates that rural hospital revenue may drop by $87 billion in the next 10 years. So this new context that we're working in is extremely complicated and very ambiguous. From an Iowa context, the impact of the budget bill, federal budget bill, is going to have significant drawbacks. And the state of Iowa implemented 2 years ago a significant income tax cut. And this next year, the state will need to rely on reserves just to simply balance the budget. Iowa's not going to be in a position to assume the responsibility to cover the federal cuts to Medicaid and SNAP, as well as the host of all these other programs that have been cut and shifted to states. And I fear this is going to disproportionately play out in rural areas. So my last point on this is, I think it's really going to be difficult to comprehend this domino effect that these and other budget and program cuts are going to have, not only for state health departments and health systems, but for the local health departments as well. Multiple systems are going to be disruptive, and I do predict that there's going to be sprawling impacts across most sectors of society. And ultimately, when we start connecting all the dots, I do anticipate that there's going to be a decrease in the quality of life and the life expectancy in this country, and it's likely to have a negative impact on future generations. It's been said before that rural areas will likely be the canary in the coal mine, and they're going to experience these impacts from all of these drastic changes earlier and quicker more than other areas.
Well, that's a very tough picture you've painted. I don't think I can disagree with it. I'd like to ask Brandi to step in now and tell us about the work that she's been doing and what specific challenges she experiences in working with rural communities. Your lens is a little bit different because you're looking primarily at the state of Missouri, but I think you've got a tremendous amount of information and insight to add to this conversation.
Yeah, my lens is a little bit different for a couple of reasons. First of all, while some of my team members from the Madison County Environmental Roundtable, as well as my colleagues here at the Missouri Department of Health and Senior Services, work with a wide spectrum of different chronic diseases, I specialize in environmental contaminants and preventing a health risk by preventing those exposures rather to the environmental contaminants. So it is looking through a very specific lens at that. But in that, the contaminant that was most of interest for Madison County is lead. We have several counties in Missouri where the entire county is a Superfund site due to the prevalence of lead from historic mining events in those areas. And those mining, smelting, and milling activities brought a lot of lead to the surface, which is now an issue for the residents, or potentially a health risk, specifically for children. So for those of you that may be on the call that aren't that aware of the lead health risk, for kids, it can do damage to the brain or nervous system if ingested. It can cause lowered IQs, behavioral problems, slowed growth, hearing loss, a whole slew of different impacts. And so we like to try to educate people about it because we have entire yards. It's not just a lead paint issue in this particular community. It would be entire neighborhoods that could be contaminated by lead. And while we have systems in place to help go through and clean these areas up, a lot has to be done through getting the word out and health education. We're facing two different challenges that Angie happened to touch on here, though, in addition to it being environmental contaminants that we deal with. So we have some challenges that are present all the time. With environmental contaminants specifically, they're often something that people don't perceive as a threat. Maybe it's something that they can't see or smell in their indoor air, such as radon, or maybe it's something like lead in the soils. And historically, lead has been something that has provided jobs and industry in the area and helped put food on the table. So we really have to watch how we frame those messages to not take away from any of the history of the area, but also help to show the health risk there. So as we're trying to get these messages out, though, there is that general challenge of people understanding what the risks are, but we're moving into a lot of challenges where we've lost a lot of our federal partners that would help us in some of these activities. We have a lot of funding that's either been rescinded or maybe at risk for different programs. And so there's a lot of uncertainty there related to that and how things may go forward. As I mentioned, in this particular area, they do have systems in place for going through and cleaning up these yards, where EPA will come in and test the yards. And if they're contaminated, they'll actually take up the dirt and put down clean topsoil in its place, so that there's no longer the heavily lead contaminated soil in the yard. But the funding for that program has been halted indefinitely. And there are hundreds of yards in this county alone that we know need remediation still. So there's definitely some challenges that lay ahead that we don't know exactly how we're going to face them. We have multiple teams working on them, both at the state, local, and the federal level. But these are definitely uncertainties that have come about within the last year. And if we were looking at what our challenges were last year, we might be focused more on those health education messages and how to get out the word. And now we're looking a lot at our funding, our rural health systems, and how to keep systems going and programs going that we currently have in place. Sorry,
Wow.
I couldn't paint a rosier picture, but that's that's where we're at right now.
Well, I'm not sure we're in a rosier picture kind of scenario, so I'm glad that both of you are being very truthful and telling it as it is. And I'm sure our audience will pipe in with some observations that may that may provide a different perspective, and we absolutely want to hear from folks who see it differently. I think there is no question for what we hear that a number of the issues that you have both raised are front and center for so many communities across the country. Maybe we could talk a little bit about. I know that you've given us a bit of a bird's eye view of the work you've done in chronic disease prevention. Excuse me. But I wonder if maybe you could talk a little bit specifically about what you've done in rural communities on each of you on preventing chronic disease, and how can we best understand the challenges that are specific to rural communities? So, Brandi, why don't you start with that one, and then we'll come back to you, Angie.
Well, because I deal with environmental contaminants and Superfund sites, some of the most successful programs that I've seen, of course, they start at the local level and they work their way up, but they do have cooperation from both the local, state, and federal partners. We have cooperative agreements in place that help not only remediate, get the soils remediated in these areas, but they also help a lot with these health education messages and blood lead testing for children. And we have a lot of metrics that we try to track along with the outreach to try to see if what we're doing is actually having an impact and actually making a measurable amount of difference. So with some of those rural health challenges, or you ask how you were alluding to kind of some of the challenges we have in those areas. One of the problems that we have that is still consistent is in our rural areas, whenever we're trying to get out the message, even whenever we know that there's an area that definitely has contamination, we often have to look at different ways of getting the messages out in those communities. Social media, things like that are great, but in our rural communities, it often means more whenever something comes from a trusted voice. That could sometimes be the local, the county or local public health agency that's there. And they often are great voices in the community, but we also have a stakeholders group. That's the Madison County Environmental Stakeholders Group. We have some other stakeholders groups in other counties as well. But they are a group of locals, businesses, individuals, and some of our medical workers in the area that all come together along with our other agencies that are working with these cooperative agreements to try to provide their voices and different initiatives or activities that we might be able to do or that they don't think that we should do that might help out the community. So our stakeholders group is really influential in helping make those decisions and get the word out to people. But we do have to think outside the box. And there are many of our rural communities where people have set up some non-traditional types of health education outreach because maybe a gas station is the biggest hub in their area. And so they've set out a health education booth at a gas station at times, or they've put out a sign out at the ballpark where you can have different sort of signs there or billboards in different areas. Because as you mentioned with those, some of those older communities or older members of the community, I should say, some of the social media messages don't hit them in the same way. And so they try a number of different outreach techniques, but often it's something that whenever people see it within their community, something local, that it seems to make more of an impact to them. So we do try to get our messages at the local level rather than just doing some of the more broader from the state level down social media messages and other things.
That's great. That's really helpful. Angie, anything else you want to add to that?
You know, Carmen, I've been in a very interesting role my entire career in the fact that I've been in a hierarchy that links federal government to state government to local governments. And I've been in parts of that hierarchy in which I always had to try to build a trusting relationship with local areas and local public health offices and community action programs and other local nonprofit organizations to advance public health work. And that still remains a challenge today. I do consulting with different federal agencies and trying to provide technical assistance and scientific guidance to many of their grantees. And even being a pseudo representative of a federal agency in those interactions, I still need to focus on how can I meet them where they're at? How can I build that relationship? How can I establish trust before we can even get to the point of providing guidance and counsel in how they carry out their grant activities? And so I still see that today here in Iowa and the work that I do nationally. So it's building that relationship, building trust. And unfortunately, that's harder today than it ever has been.
So one thing that I think is important to acknowledge is a comment from our audience, thanking both of you for being honest about the challenges that are in the current environment. It isn't just about being innovative and having new, bright, great ideas. It's really about looking at what you have to work with. which is, as you're both pointing out, a much greater set of challenges and a much smaller set of resources than ever before. I want to ask you to both, keeping that in mind, keep our thinking. Uh, any ideas that you come up with, that you remember, examples that you've seen of innovations that you think could be broadcast to other communities facing a number of the similar challenges? Let's try to keep them also in the conversation, because that can sometimes be the really nice impact of these webinars, is the fact that we get the chance to help teach each other and lift each other's issues up and ideas up. So let's go ahead and just see if there's anything you want to add about how the work has changed in the last 5 years, and how you've addressed that change. Uh, Angie.
So I'm going to take a little bit different approach to this and try to put on a positive spin on the factors that have really changed this work and some of the assets that perhaps we can leverage moving forward. And so I have about four things that I wanted to highlight. The first is the availability of technology. And with the impending changes and that ripple effect of all of these changes coming down from the federal government, how do we best leverage telehealth opportunities? How do we best leverage the use of cell phones and updated technology to support both public health and healthcare systems? How do we get that technology to be better coordinated at a local and regional level? How do we best leverage social media and our digital assets that we have? And AI is a part of this conversation, of course, but we do have technology that can be leveraged to address some of these growing challenges in a rural area. We also have, I think, greater availability of public health research, data, and perhaps there's even more discussion about the urgency of being able to put that data into action, and more conversations about translation and implementation science. And so I really think that we do have some really great repositories of data that can help us with this work. And I wanted to specifically highlight the use of economic data to help us with our messaging, to help us with our decision making, to share with our partners and collaborators. And that can be in a wide range of narratives or capacities, but how do we create messaging around a positive ROI? So here's some examples, some goodies but oldies. For every dollar invested in SNAP produces at least $1.79 in economic activity. For every dollar invested in WIC results in at least $1.77, if more than $3 in Medicaid savings. We know that WIC works. For every person enrolled in a diabetes prevention program, it saves, $1,100 a year in Medicare expenditures. And so how do we best leverage that data to help with our messaging, not only with those who fund our work, but those who are living in those communities that we are working in? Another thing I wanted to highlight was the passionate public health workforce. Du Beaumont Foundation just released their public health wins data recently. And yes, there's many challenges with recruitment and retention of the public health workforce. But there's also a very high degree of job and organizational satisfaction among public health workforce. They have a very high sense of belonging. According to this survey, about 75% of them do plan to stay in their jobs. And I have worked with some amazing practitioners in this country. They're very passionate professionals. They want to continue to learn and contribute to decision making. And they do want to be engaged in those budget management decisions and how do we craft appropriate policy to best help our communities that we're serving. And so I do want to highlight the Public Health Wins survey data for folks as well. And the last one is, I think, really critical, link back to the public health workforce, and that we have seen an increase in public health education in this country. Data from the University of Minnesota has indicated that we've seen an 1,100% increase in public health degrees awarded from 2001 to 2020. And according to CEF, there are at least 95 DRPH programs in the US, and that number continues to grow. And this was one of the reasons why I decided to go back to school later in my career and to complete a DRPH in leadership from the University of Illinois, Chicago. And it gave me these new tools to address these growing adaptive and complex challenges that we're facing today. And what really excites me about this work is being able to apply these new tools today and to also make these tools more available to others. And so those are some of the positive features and changes that I've seen recently, Carmen, that I don't want to lose sight of and just wanted to weave them into the conversation.
Yeah, thank you for that. Brandi, what would you like to add?
Well, I would say some of the changes that we've seen, and again, I do deal with environmental health field, but we've seen changes in our regulations in the past 5 years. For example, the blood lead reference value for children, which previously was 5 micrograms per deciliter, has been dropped to 3.5 micrograms per deciliter. That's the level at which, the threshold at which you would provide medical care or intervention for children if it was above that. So that level has been lowered in children. We've also had their remediation level for soils lowered from 400 parts per million to 200 parts per million. So these are good changes in that they're more conservative to prevent exposures. So that is a positive thing, but it also creates a lot more work to be done. Or as you might imagine, you might expect that if you lower that threshold, that you're going to see more kids with blood lead levels that exceed it now. However, on the positive side of things, our public health messages have been doing a really good job, and all of the testing that the local health department has been doing in their community has been doing a great job, because we've actually found that even with that lowered threshold, we do not have more children in this particular community that actually are seeing elevated blood lead levels. So that's good. That's showing that the work that they're doing is actually making a difference. Because across the state, we have as a whole, whenever that threshold was dropped, we did see more elevated blood lead levels coming in, as one might expect. So we like to be able to look at this data and see that even though these regulations are getting a little more conservative, that is something that is helpful overall for the community's health. It does require a little bit more work on our parts, but we can also see that even going by these more conservative thresholds, the public health work that's being done, it really is making a difference. Little by little, it may seem like a drop in the bucket today, but pretty soon, if you keep working, your bucket may be overflowing. So we're really happy about being able to continue to keep these numbers down for the children that are having the elevated blood levels.
Well, that's some good news about lead. Thank you. You brought up the issue about partnering with gas stations, and I think I want to get into that as a jumping off point for the next question about collaborations. It seems to me that one of it's phenomenal that that so many more people are being educated in public health than were educated in the past. And when I was in school, it was really almost an unknown area to go into. So I'm particularly gratified that it's becoming a much more interesting area for young people to want to get into. But I'm also a little bit worried that over time, as we become a more professional field, that sometimes we're not as effective in bringing in the kinds of partnerships that are really needed in order to do the work of making the community healthier. And so I'd like you to start, Brandi, and give us some of the best examples that you've seen about how you get other people involved in this work, in this greater work of improving the public's health? What are the collaborations about, and how do you get people engaged? Because it's that engagement that then gets people involved in that whole civic process, which hopefully will help people to understand why they are, why they are part of a society and why they should be contributing to that. Anything you want to give us on how to
Sure.
stimulate these partnerships?
It's different for every community, of course, and but community engagement, of course, is key. Whenever they were starting out, for Madison County at least, they started out by establishing whenever they would have specific quarterly meetings at a designated time with a designated contact, a designated location. And then they started by handing out 75 to 100 invitations around the community each time that they were having one of these meetings. They'd hand them out in advance and then they'd talk to their local community members about it. And it started off slow. They didn't get that much participation at first. It was definitely something that they had to keep going and keep trying with, keep sending out the invitations. But over time, they did receive more and more people coming in, some of which were skeptical because some of them were historians. And, I mentioned that this community had historic mining industries there. They were historians in the community and they had worked at the lead mines. They didn't necessarily think that lead was harmful. But after talking to them and having some respectful debates, they were able to show them their evidence and kind of turn them around. And once you have a voice that is a loud voice like that, one of those champions that may have been opposed before and now they're on your side as a public health champion in your community, they really do help convince others to come into the fold too. So getting someone like that is key. I have found though throughout these different communities we work in, one surprising place that you may go to that you may find some support though is through your historic societies in the area. They often do know the history of the area. And, I deal with contaminants that are sometimes related to industrial processes. So they often know the history of those things in the area as well too. And they can sometimes help guide some of your messages so that you're being considerate to anyone that was involved with those industries while still letting people know about the health effects and the messages that you're there to share with them. But I would definitely say one thing that is just really important is to have a dedicated time and place that you're meeting, a dedicated contact that people can contact, and to keep getting the word out at first and just making sure that you are repetitive about it. Eventually, you will get some people to come in. But the how long that time takes is different for every community. Sometimes these start off and we have a lot of interest right out of the gate. And other times we have to draw the community in. So it does vary quite a bit from location to location.
Yeah, very helpful. Angie.
Yeah, thanks, Brandi. Those were great examples, great examples. I've always said that, relationships are critical in this work. Collaboration is essential in this work, and especially in rural areas. And that collaborative nature needs to be part of the culture of your organization. And as Brandi emphasized, communication is that key ingredient. I really like the quote by great football coach Vince Lombardi, and I know Dr. Ellinger's on the call here. Go Green Bay. But he's always said that the way a team plays as a whole determines its success. And so when we talk about our work uh, being collaborative and building partnerships at the local level, we got to make sure that that's part of our culture within our organizations as well. And some of the ways that we can help, build those partnerships and build those relationships is think about it in a very systems-oriented fashion. And so systems thinking can be a really great tool in building collaborative relationships, especially in rural communities. And it helps create shared understanding of really complex situations, which we are very deep and getting deeper in an extremely complex situation. But systems thinking can help us cultivate that common ground between partners and identify interconnections among individuals and groups. It also, using a systems thinking approach also helps us with bringing in those diverse perspectives within communities. And that helps us build much more of a complete picture of the system. And I think now having these conversations, learn from our partners as to what they're experiencing as a result of many of these changes at the federal level. But the other thing that systems thinking can help us do is identify opportunities for innovation, identify low-hanging fruit for policy, system, and environmental change. And it also helps us with identifying leverage points that can inform our strategy development. So I want to throw out there the concept of systems thinking to help us build these relationships, and especially to help rural communities in building and sustaining those relationships.
Let's drill down a little bit more, Angie, and talk about any particular experiences that you've had with getting grassroots or neighborhood levels engaged.
Yeah, and this is where I haven't actively worked at that level, at a local level. I provide guidance and counsel and assistance to local entities across the country, whether they are local health departments, community action programs, they might be tribal health organizations, and boards of supervisors and boards of health and things like that. And so my first response is to really listen to where they are at as an organization, and what have they tried and what have they not tried? What assets do they bring to the table? Where are their pinch points? Where are the areas that they really struggle in? And so my advice, my coaching to those who are really trying to build those collaborations is to sit down with a piece of paper and map out who's in the community. That's usually the first step. And with changes in public health leadership in local levels, with changes in even health system leadership and administration, having that bird's eye perspective of what's really happening on the ground is a really great place to start. And so it might be on a napkin while you're having coffee with someone. It's a place to start. Who's in our community who are the movers and shakers? Who in the community are the influencers and the power brokers? This is another thing that I think that local public health agencies and some regional health systems may not be fully leveraging is their power brokers, those who really influence what's happening in those communities, and especially in those rural communities. I wanted to give a shout out to Clarinda Regional Health Center here in Iowa. They have been recognized in the last couple of years for not only the healthy work environment that they've created for their staff and their practitioners, but how they have created very positive and productive environments in their community. They're very active in the community, from doing things such as mentoring high school students. They started a community wellness garden. They have led a regional emergency management and preparedness effort. And just recently, they received a 5-star rating from the National Rural Rating System. And so a very regional health, rural health system here in Iowa, they're engaged in their community. They connect with community members. They're connected with a variety of groups that are active in the community. They have assessed and identified who the influencers and the power brokers are within the community. Sometimes in a community, it's people that you don't think of, whether it's a bank president, it could be the co-op manager, for example, it could be the grocery store owner, it could be the healthcare clinic administrator, perhaps the technical college president, school superintendent, the football coach, and don't forget clergy and other faith-based organizations. And so having a conversation about what's the composition of our community, who's at the table, who's not at the table, and who those power brokers are, is a really great place to start with that discussion on partnerships and collaborations.
Thank you. Brandi, anything you want to add? You've given us such great examples so far, but I'm sure a few more come to mind. Anything you care to throw in?
No, I really just love what Angie was saying about mapping it out. That is so key, and that is something that we try to do with our teams too, whenever we go into the area. So I think that's great advice.
So let me come back with a question that came from the audience. How can we get community health centers more engaged? And I like that you lift up one already, Angie, but I'd like some other ideas about how to get community health centers engaged. Brandi?
Well, that's a little bit, I guess, a difficult question, or not difficult, it's too easy for me because I work for the state health agency. So we work with every one of our county health departments. And we have working relationships with all of them, and they are all very busy, but they're also very committed to helping the health of their communities. So we have an automatic gateway to work with those local agencies. We have to work through them though, whenever it comes to some of the other things we do. If it's for a rural hospital or something like that, we would have different ways that we would have to go about it. But for our local public health agencies specifically, we do have a direct gateway. So we have a awesome benefit in that.
Yeah, I was thinking more along the lines of the community health givers that are community-based, like the FQHCs. I'm wondering how, particularly in lead, how you get FQHCs really, really, really engaged, really activated on the issues that you're working on.
Well, we have at each of the local public health agencies, we also have registered nurses that do a lot of the work there, and they are key in being representative with all of our other local medical providers in that particular area. They have working relationships with them often, and when it comes to the other portions of things through the state health side, I have to admit, because I do environmental health, I don't work with that side. That is done through our childhood blood lead prevention program. And they actually reach out more with those entities directly.
Yeah. Anything, Angie, you want to add to that?
Again, thinking about the models here in Iowa with FQHCs, there's co-location of services that happen, whether it is WIC in an FQHC or Title V MCH, working closely with an FQHC. It could be sharing of workforce. And so the local public health office may have a nurse for 50% of the time, and the other 50% that nurse may be with FQHC. Definitely doing joint community events is another way of engaging FQHCs and even other health systems. I think one thing that binds all of public health together is the impending cuts to Medicaid. And so if you have not reached out to your FQHC, do it now so that you can start having these conversations about what that ripple effect may be, not only on the institutions within that community, but on the population that they serve.
So there's two questions that have come up from the audience, and I'd like to kind of stick them in now. They're really, really important and fundamental. Do you think that there is any way in an environment in which we are being kind of warned off having a discussion around DEI? Why is this important in rural communities? And what are some strategies that we can use in order to keep focus on inclusion in models? Let's start with Angie.
That's a great question. I think one way of looking at it is, how do we frame our services from a determinants of health standpoint? And so we've got great models out there on social determinants of health and political determinants of health and commercial determinants of health. And keeping that at the forefront and integrating those elements in our assessment, planning, implementation, and evaluation of public health work is critical. I think especially in rural areas, having a really good knowledge of the demographics of the community that you're serving is essential. And again, this is where system thinking comes into play, where you sit down with all of this information, and it's not just quantitative demographics that we're talking about, also collecting qualitative information about your community as well, and create a picture of what you're looking at, and making sure that all populations are being represented in that picture. And again, using not only a critical examination of the data and of that community, but a systems perspective to our work is going to integrate diversity, equity, and inclusion initiatives into it naturally using a determinants of health lens. I know organizations have opted to, scrub much of their digital assets as well as eliminate from their policy and procedures the terms, similar to what's happened at the federal level. And I understand why that's being done. But I also think that carrying on with the service provisions that we do, we can still uphold the values of diversity, equity, and inclusion.
Brandi?
So here at the state level, we do have a lot of federal funding that comes down from CDC. And we did have the order that came down from CDC regarding the exclusion of DEI language. We have complied as needed for the grants that fall under that. And we intend to comply with that. However, our purpose here is to promote positive health outcomes for Missourians, all Missourians from pre-birth to death. So it does not change our mission, how you word it one way or another. We're here to serve everyone. And we're just trying to work the best through these challenges as we can. So while we have changed written communications, we've omitted using some materials, or we'll go forward with watching certain phrasing, I guess, moving forward in materials. Our mission itself has not changed. Now, some of the programs that I'm aware of, most of them have complied for funding purposes. Nobody wants to lose their funding, especially with so much of it already at risk from other actions anyway. But with that too, I do know some programs that are against changing the language. They are very much for what is written in with their equity and inclusion language. And I can absolutely respect where they're coming from as well. So I think it really depends on the program. It depends a lot on your funding sources too, how you may fall in line with that. But like I said, from my particular position here, we have watched that on all of our materials due to funding, but it does not change our mission. Our mission remains the same.
So I think one of the things that's really important these days is how we talk about what we're doing. There's no question that media is playing an outsized role in developing, really shaping people's opinions. So I'd like to know what kinds of messages you think have had the greatest impacts in your communities. And Angie, why don't you start?
It's hard for me to answer, Carmen, again, because my role has not been hyper-local per se, but I think I want to emphasize that even though there's a lot of disruption happening around us, communication first with your team and with your organization is critical. I want to emphasize that, with the disruption at the federal level and how that trickles down to states and local, they're experiencing paralysis at the federal level, and communication has stopped in many aspects. But with your team, it doesn't have to be that way. We need to empower our teams first, and that communication and that messaging to our teams, I think, is maybe perhaps a priority right now. And then once you have empowered your teams with sufficient information and resources and support and opportunities to do their work, then focusing on the messages to communities in especially rural areas is that next step. But I'm seeing a lot of paralysis right now at both state and local level, at federal levels too, but at state and local levels. And this paralysis is preventing even communication and appropriate messaging internally. And so if you are a leader in an organization, think about how you are empowering your workforce. Are you giving them adequate information? Are you giving them resources and support and opportunities? And then from there, how are you applying that same approach to the messaging in your communities?
Brandi, I'm going to give you the last word on that. You've got about 30 seconds.
I would just say sometimes our messages, our health messages, are a little bit challenging. So we put them before our stakeholders group. We have the benefit of having that group and we use it. And they have vetoed some of our messages and they have greenlighted a lot of other ones. And we really appreciate them and that feedback. And it is really essential for making sure that we put out messages that are going to land with that specific community.
So I really want to thank both of you. There's no question that we've had two great masters in this conversation, and I really appreciate all of your work and all of the thought that you put into coming to this table and having this conversation with us. Thank you so much to the audience for the great feedback and ideas that you gave us. We do preserve all of your questions and all of your thoughts, and we use them in helping us to understand where we need to go next in our series. Just thank you for all of you for joining us, and be sure to visit the website in order to hear about the next in the series, the Masterclass series. Have everyone have a good rest of your day, and please stay cool and stay healthy. Thank you.